Is Candida causing your gut and thyroid issues? That's what we're going to talk about today, how to find out if you have it and how to fix it. My name is Dr. Thomas Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and I've had the pleasure of seeing over 100,000 patient visits over the last 36 years, many of whom have thyroid and gut issues, and a very common root cause I see is Candida overgrowth, which is a type of yeast, a fungus that's normally in your system in certain amounts. However, when you get an overgrowth of Candida, that can cause significant issues. Candida overgrowth is more common in women. However, I've seen many men patients that have had this, and it's something I dealt with years ago as well. And I had these common symptoms of fatigue, brain fog, as well as sinus congestion, very sensitive to fragrances, chemicals like gasoline, exhaust smell, itchy ears. I remember when I would eat something that had a lot of yeast in it, like for instance, we drink wine or have bread or even apple cider vinegar, my ear would itch. So that's a sign. Abdominal pain, gas, bloating, IBS, diarrhea, constipation. Also, you can have white spots on the back of your throat or white coating on your tongue. Frequent urinary tract infections, vaginal yeast infections is the most well-known symptom. And prostate issues, though, can be, a lot of people don't realize, can be caused by yeast overgrowth. This is something I had dealt with when I was going through this. And as far as skin, acne, white spots on the back of your shoulders and arm, those sunspots. I remember in the summertime I'd get tan, but the white spots wouldn't, and they look a lot worse in the summer. That's a sign of Candida overgrowth. And then you can get eczema, psoriasis, rosacea. When I was younger, I had rosacea. I had various types of eczema, and you can get itchy skin, dandruff. I dealt with that also when I was younger, and itchy eyes. I had a patient once who woke up, her eyes were all crusty and red. This was after a weekend of drinking too much champagne, which is loaded with yeast. Joints, aches and pains, numbness, tingling. All those I dealt with. An autoimmune condition, so I had Hashimoto's and rheumatoid arthritis. My antibodies were elevated. Candida overgrowth was part of my root causes for that as well. And difficulty losing weight is a sign of that. And of course, sugar, craving sugar, alcohol, bread, and PMS. Worsening of PMS is a sign of Candida overgrowth. I didn't have that though. Why is this so prevalent? What causes this? Well, antibiotic use is number one. When I was a kid growing up, my father, being a medical doctor, would give us antibiotics for every little thing, colds and stuff. So I was on a lot of antibiotics. Got a chronic sinus issues, just antibiotics for that, which then ends up making it worse. And ended up having my adenoids, which are a type of tonsils up behind the nose there. Had those removed because my sinuses were so congested. So it is something that antibiotics is the number one cause, but also steroids, prednisone, even the inhalers, steroid inhalers, birth control pills are common cause, antacids. So when you eliminate the acid, when you reduce acid in your stomach, you can get yeast overgrowth. And also a diet high in sugar and starches, yeast-containing foods as well, beer, wine, vinegar, those can increase yeast overgrowth. So how do you know if you have yeast overgrowth? Well, stool test is one way, and a blood test is a test for Candida antibodies. We have this one test we do that checks 10 different types of Candida, besides Candida albicans, other types, as well as for other types of fungus. So how do you treat it? Well, the medical treatment is antifungal medication, which you can use for very short-term use because there are considerable side effects and can be very toxic to your liver. The other challenge is it tends to be just a temporary fix and not clear up the underlying issues. So treatment that I use myself and with many patients over the years is, number one, diet. So since yeast thrive on sugar and starches, we have to starve the yeast. When I was dealing with this and realized this is one of the things I had when I was going through all my health issues, I had a gluten. I realized I had a gluten sensitivity through testing, so I was avoiding that, which started to help. But the thing was, I was still eating the gluten-free breads and pastas and the gluten-free cookies and all that. So I was still feeding the yeast. Wasn't getting better, and found out I had Candida, so I was following the Candida diet. But even with that, you can still have millet and other grains, and you can have things like kombucha and apple cider vinegar and all these. Every time I would have these, like, my ear would start itching. So, and sauerkraut, like fermented foods, they were supposed to be so good for you in the Candida diet. It just wasn't working for me. And ultimately, through trial and error, I figured out the foods which avoiding would help me get better. That's how I came up with what I call the FreeDiet, because it's free of not only gluten, but gluten grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, chronic digestive, and other health issues. So once I did that, I started getting better because I was not only healing my gut, but I was starving out the yeast and when you have yeast overgrowth, and which leads to leaky gut, you become sensitive to other foods and more prone to other infections. So it turns out I had also bacterial overgrowth and a parasite. So this diet, the FreeDiet, along with the supplements, worked on all of that. So ultimately, that's how I healed and got better. And my Hashimoto's antibodies went down to normal. Rheumatoid arthritis antibodies normal. So they've been normal for over 12 years now. And my gut and skin issues and fatigue, all that cleared up. So the diet was really integral in this. And as far as a brief summary of what you can eat are healthy proteins, meat, chicken, fish, plenty of vegetables, plenty of healthy fats. And again, you're avoiding the gluten, grains, sugar, yeast that are feeding the yeast, all right, so you're avoiding those foods. So, but if you check out the food chart, it gives you over 80 foods that you are allowed to eat and all the avoid foods on that. I'll give you a link below where you can get a free copy of the FreeDiet Phase 1 food chart. And besides the FreeDiet, I recommend natural antifungals, product I call yeast defeats, and another one called Candida Dissolve. So either one of those two. And then the Functional 5 multi-fish oil, vitamin D with K, magnesium, and very important are probiotics. Probiotics are very important in dealing with this. And I'll put some information below if you want to take a look at those. So that's what I would suggest for Candida overgrowth is, 1, finding out if you have it. 2, use the proper diet. I recommend the FreeDiet and the appropriate supplements. So it can be very frustrating dealing with these chronic health issues, the gut, thyroid, skin issues, sinus, brain fog, fatigue. However, just like I was able to get better, if you find out the root cause and are provided the right solutions, I believe most everyone can get better. So thanks for joining me today. If you want a copy of the FreeDiet Phase 1 food chart, just click that link below and feel free to like and subscribe. And I will look forward to seeing you next time. Take care.